So welcome back, everyone. We're live on Facebook, so hi to everybody out there. Like us and follow us. We'll share the show later on. My next guest is a newbie. I have with me Dr. Katie Prenovost. Did I say it right?
Pretty close, Prenovost.
Prenovost.
Mm-hmm.
I knew it was something like that. She is a pediatric physical therapist. You're the owner of Total Pediatric Therapy. I want you to tell everybody a little bit about yourself, what you do, and welcome to the show. I'm going to have you get right up on that mic.
Okay, right up on the mic here. So we offer physical, occupational, and speech therapy services to children. So that can range from infants to 18 years old. We really treat all ages and all abilities. It can be an acute issue, a long-term care issue. Your child does not need a diagnosis to come into our clinic. There's a number of conditions and concerns that we can address without that on board. I have found it's really helpful to explain what each of those disciplines do, if that's okay. So a physical therapist will work with functional movement patterns. So we look at developmental delay, strength, balance, coordination, range of motion, maybe an abnormal walking pattern, those type of things. Occupational therapists work more with fine motor skills and activities of daily living. For a child, that could look like dressing, eating, self-care activities, play skills, handwriting. They also work a lot on motor coordination as well. And our speech therapists really are the most obvious, right? So they're going to work on sound production, fluency, so that a child can really be an effective communicator.
You, before you came on, were talking with one of the guests that was here, and you said that you have young ones that come in like really young. How young?
Yeah, I mean, I've seen as little as 2 weeks old. If a child is born with advanced medical needs, starting therapy services sooner than later really leads to the best outcomes.
That's so sad. Now, but you're there.
I'm there.
You're right there
and
to
we can help,
them.
so it's
That's
not
what's
sad
really
because
neat.
we're empowering them.
Where are you located?
We're in North Scottsdale, so pretty far north, close to the Cape Creek border. It's close to my home and in my community, so that's really where we wanted to service.
Now, when you hear things like this, I'm telling to the public out there, this is something that may be for you. You might be a grandparent of, a child that that might need some help. Because I think the older we get, we start seeing things. Mm-hmm. Sometimes when you're the parent, there's a lot of times that they not want to see it first, and then but they know.
Well, everybody loves a child, right? Mm-hmm. I mean, most people love some type of child, and we're really a resource in so many different ways for development across the board, whether or not you think there's an emerging concern.
Now, the website is Total Peds, so totalpeds.com. Their phone number is 480-588-3656. Now, your business is unique, you say.
Agreed.
What makes it so unique?
I really think the fact that the quality of care we're providing really addresses the whole child. You come into our clinic and you're going to get a one-on-one session with a licensed provider. We don't use aides, we don't use assistants. These providers all have their master's and their doctorate degrees within their discipline. It's a very open environment. We really encourage education and awareness for the family so they can carry over things at home. It's fun. We have a rock wall, we have a climbing structure, we have a slide.
That's cool.
Therapy has to be fun for children for them to be successful.
Absolutely. Even for adults, as far as I'm concerned, I wish it was. I want you to explain how, because a lot of people think right away that they have to go to get a doctor's order.
Right.
But you're saying no.
Yeah, so Arizona is a direct access state, and we carry our own licensure per the boards. There are a couple insurance plans, some of our access plans that do require referrals, but majority of your commercial plans do not. Also, because we carry our own license, you can come to us at cash pay at any point in time. So
again, that phone number to call is 480-588-3656. The website is Total Peds, PEDS.com. They're located in North Scottsdale. And I think it's really important for people to try and get on the top of this because, number one, let's say it's a speech impediment, okay? Yeah. How often do they get bullied?
Yeah, there's certainly a lot of social implications that can come
when it comes with all of this because, and if you're on top of it, it can change their world.
Yeah, let's talk about that whole child approach, right? The way that we're delivering care opens a kid's opportunities and perspective. So you think I'm working on teaching your child how to walk, but really all of a sudden their social interactions increase and the way they explore their environment increases, and now you've opened their entire world. That's a great way
It's
to put
so
it.
awesome.
Yeah.
Now, the team of
Yeah.
providers, go ahead.
I get so excited to talk about my team because we have such a strong system right now, and it's really their knowledge and their passion that's delivering this type of care to kids in our clinic every single day. They have some really unique specializations, which I might talk about a little bit later, to bring into our community, and we really focus on a team approach. Being multidisciplines, we have those 3 different disciplines. We work together to really make sure that all of our kids are getting exactly what they need.
And again, we're going to make sure that you understand, this is for children from ages, you said 2 weeks?
Infants, yep,
to
18.
to 18. Again, that phone number is 480-588-3656. It's Total Peds, PEDS.com. Specialized programs, what are they?
So aside from your bread and butter of the PT, OT, and speech that I mentioned, because our providers have so much additional training and certifications and specializations, we're doing a lot of cool things in the community. So a couple of them for you. Our speech language pathologist has developed a reading program for children with dyslexia, and it really focuses on the oral language and bringing that into the brain for literacy. It's really a wonderful program. She also does oral facial myofunctional therapy, which looks at swallow dysfunction for speech sounds.
Oh, that's awesome.
Yeah. Our
I think I could use that.
occupational therapists do feeding programs for picky eaters or kids with oral motor issues.
I know a lot of picker eaters. That's amazing.
We do intensive therapy programs, which is high intensity, short duration, very goal driven. One of my PTs also does serial casting. This is a lot of content I'm throwing at you, but all really cool stuff. Serial casting is the process of casting a child to address like a contracture or ankle mobility issue. It's a great option. When you're looking at something like surgery, it can really prevent that. So
Now again, we're going to get that phone number out. Maybe it's you or someone that you know. The phone number is 480-588-3656. Total Peds, PEDS.com. I never would have asked this, but I'm going to ask it, okay? Do you accept insurance?
yes, we talked about that a little bit already. We do take commercial and access plans. There's a list of that on our website, totalpeace.com, so that's always helpful. We also have cash packets available. The insurance industry is changing dramatically, right? So some plans don't have therapy benefits, so we do offer reasonable cash rates, and things like the intensive program and the reading program, those are all cash based.
Now, are there any upcoming activities that you got going?
Yes, we have all kinds of fun stuff coming up. We have our next intensive therapy program next week. We have another one coming in July. So these kids are coming in for 15 hours of pretty intensive therapy, and they just smash their goals out of the park. Stuff that would take us 6 months to accomplish, if we were seeing them once a week, we're obtaining in 1 week. It's outstanding. Yeah.
Wow. Do they like it like that?
Love it.
They do.
mean, you get a little meltdown here or there. That's not abnormal because it's hard work. But
Mhm.
again, in the right supportive environment, they can be super successful.
Do you utilize, let's say, your rock climbing and all of the other things
Mhm.
that you have there within almost all of the different programs, or no?
Now, I do as a physical therapist because that's my bread and butter. But yes, our other therapists will often use it. Like our speech therapist will use it as kind of a reward system often
Mhm.
for, kind of completing the work she needs them to complete as well.
The number to call again is 488, I'm sorry, I said 488, I meant 480-588-3656, totalpeds.com, PEDS, and they're located right in Scottsdale. So I gotta know what the goals are for you and the clinic.
Yeah, our goals really come from wanting to create a culture of support, okay? So when a parent finds out that their child is gonna need therapy or support, it's a very scary time for them. There's a lot of fear, anxiety, questions. So we really have worked hard to create an environment where the parent's supported because they're getting the education and the knowledge and the information. The kid's just having fun, and we're working as a team to make sure they hit their outcomes. At the end of the day, I can tell you after being a provider for 13 years, the sky is really the limit for a child that's empowered. I mean, every single day we are seeing kids do things that they were told they shouldn't be doing. And that's because we're providing an environment for them where they can thrive. They're empowered, their parents empowered with the knowledge, we're empowered as the team, and that's really what we're all about.
Or when you said that they were told they couldn't do, maybe they can't do.
Yeah,
You know, I mean that's gotta be big.
Funny you say that because often we hear I can't, and we challenge our patients, our family, and the providers to say, how can we do that? Maybe that looks different from one child to another. Actually, it does, not maybe. But we can obtain it. If we're working together as a team, we're going to obtain it in some way, fashion, or form.
So with the children that you work with, I would love to hear like a little success story that
Oh
you
gosh,
might have.
I
Yeah,
have
I'm
so
sure
many,
you
it's
have.
hard to pick.
Right.
Some of my favorite kids are those that are struggling to obtain like gross motor skills. So crawling or walking, let's just talk about walking because it's such a big one, right? If your child is 18 months, 2 years old, and your kiddo is not walking, they need support and they need help because now they're going to be delayed in all their other motor skills. So helping kids reach these big motor milestones that allow them to be successful in their environment and with their peers is really what's rewarding to us.
So I'm just thinking, you know, because when I was younger, things were different then,
Yeah.
right? And we were told different things.
Right.
This was probably a big problem in the first place. Because, well, first of all, I swam before I could walk.
Good for you.
And I also didn't start walking until I was 18 months.
Okay.
That seems like a long time. I
Yeah,
mean, it
it's
seems
a
like
little
there was
behind
probably-
the
I
norm.
knew there was a problem with me. Go ahead.
Doc will fix that later, I'm sure.
But I mean, my brother, who I don't know how old he was, but he used to, they used to call him Sweepy.
Aw.
He would take and then he would, you know, kind of scoot,
Yeah.
right? These are things that probably we should be looking at.
Absolutely. I mean, there are age-appropriate normal milestones for a reason, and we need to be evaluating if we're not hitting them, why, and how do we support the child with that.
The best thing to do is to not turn your head and don't put your head in the
Correct.
sand. When
Yeah.
you do see something, maybe it's a good idea to see if you can help them, and if you can change their world.
Yeah, we
right?
are the conservative approach, really.
That phone number to call again, it's 480-588-3656. They're located in North Scottsdale. They also take insurances, most insurances, by the way, and you can check them out on their website. It's Total Peds. That's PEDS.com. Again, that phone number is 480-588-3656.
And let us be a resource for your family. We're happy to help with your guys' development.
Got it in.
Got it in.